and welcome to the Vibes Cancer Podcast. Today I'll be talking to Alisa, and we're going to talk about health comparison between the United States and the Netherlands. And also, we're going to talk about unwanted advice and being the youngest person at the oncology department. So, thank you so much for joining the podcast. Would you like to introduce yourself, who you are, and where you're from?
Yeah, my name is Alisa Manzelli, and I'm 30 years old, and I'm from the greater Los Angeles area.
Awesome. What I see personally, what really is like wow to me, or well, not wow, but more like whoa, is like
Mm-hmm.
the difference between like insurance like in my country and like in America, where I mean you guys have like
Mm-hmm.
a GoFundMe for cancer, for like
Yeah.
childhood or like for adult cancer. I'm like, oh my God, like the only reason why in the Netherlands or a place in Europe we have that is if you're in the UK and you have cancer and you want to go to Belgium or Germany and you don't have the funding. Like that's the only
Yeah.
reason. If like
You want to go international, go to a different country for treatment, right?
yeah, which I think is
Well,
as well as crazy. Like I think that's absolutely ridiculous, but
yeah. Oh, tell me about it. I have to I have to fight for every scan I get. You have no
why?
idea. I just got a CT scan in November and it got denied. I had to appeal. I'm like, how can my first scan since chemo be denied? Like
That's crazy.
yeah, and I have another one in May and I have to work to get that pre-authorized or else they're gonna deny it again. And meanwhile, I'm not sure if did you happen to do any genetic testing? Was that available to you at
Yes, but
all?
but that was well for my mom. You mean for to
Okay.
do you mean like to see whether or not cancer gen is in my family?
Yeah, yeah. If you had like a cancer that was genetic versus environmental, I suppose.
Right, right. Yeah, my mom did one and we don't have it. So we like my mom did it. I think like of course it's covered by the insurance, right? For to a certain point. But I just wonder but like oh my God, I'm sorry. Like the scan you have to fight for, that's absolutely insane.
Yeah. Well, and what I was going to say about the genetic testing, I love that your response was, of course it's included.
Well, I think yeah.
I'm laughing because, oh my gosh, that's been the hardest thing for me. I got genetic testing in July and it has been denied. It's not medically necessary. They're saying it's not medically necessary for me to have genetic testing. Because, for my type of cancer, they wanted to know if I had that BRCA gene,
Hmm.
which I guess is very common in a lot of Jewish women. And it's if you have ovarian cancer, you might have a tie to breast cancer too. And so I really wanted to find out if I tested positive for this gene. Unfortunately, I didn't. I didn't test positive for any gene, which is really, really good news for me because there's no further screening I'll need to do for any other types of cancer or anything. But um, I almost feel like if I did test positive, I wouldn't be having this battle with my insurance
Yeah.
because they're saying it's not medically necessary and they're trying to charge me $6,000 for it,
Oh my gosh.
which is more than both of my surgeries combined.
That's insane. Do you know who
Yeah.
recommended my mom to do the gen test?
Hmm.
My previous oncologist.
Yeah, yeah, it was my doctor who recommended too. And then they're still saying deny that because the insurance, it's all of these people with no medical background. They're just all processing paperwork. They don't know anything. They see I think it's almost like they're conditioned to say no.
Yeah.
And then if the patient fights, then they'll reconsider their decision. It's almost like who's more persistent, who will win, the patient or the insurance company? Because if they just keep denying, they hope, oh, they'll give up eventually and pay.
That's insane. That actually like makes me want to cry.
Isn't I
It's
know, it's really sad. I mean,
because
genetic testing, CT scans, all of it has been deny, appeal.
wow, but isn't it like if you say to your oncologist or to your doctor, like, hey, I want to have a MRI scan or a CT scan, can you write me a paper and then I'm gonna have a scan today? Is that possible or no?
Yeah, that's the thing is the doctors have no problem. They'll do it. They'll say, "Yes, I absolutely think you should get a scan today." The only time it gets approved is if you are in the emergency room in the hospital and you need to get like so when I had to go to the hospital for my bladder infection, they wanted to make sure I wasn't having a recurrence and they had to scan my bladder and my kidneys and all of these things. And for some reason all of that got approved. So it's like if you go to the hospital for an emergency, it will all get approved. But if you're just planning it for preventative measures or your routine scan, for some reason, that's when the insurance companies want to give you a hard time about it.
Oh my God. Because it so the doctor would approve, but then could
Yes.
you so let's say you would do the scan, right,
Hmm.
without their approval. Is that possible, or do you need their
Yeah.
consent?
Yeah, so it is possible, and in most cases, a lot of people would pay the full amount upfront.
Oh my
So
God.
it's like if it's approved by insurance, you only have to pay 20%, but if it's not approved or if you're doing it right away, you have to pay 100%.
Oh my God.
And then the most ridiculous thing too is they'll charge if it is insured, they charge one amount, but if you're not insured, they charge another. So if you're not insured, you have to pay the full amount, but they charge a lower amount. So,
Yeah, you guys have a lot of different rules for like
yes,
different
it's
things,
ridiculous.
right? It's
Yes,
insane.
I had no idea about any of this stuff either until this past year. It's not something that's common knowledge to people until you are the person going through it with your health insurance company. It's
Yeah.
not like we don't learn anything about this in school. It's like not normalized.
Yeah.
I don't know. Like I feel like if you're going to make something so difficult, maybe offer a course or something.
Yeah.
Like maybe a class that we could take in high school even or
Yeah.
something.
Yeah.
I don't know. It's really backwards and it's it's I mean to give you an idea of how much my health insurance charged. So let's see. My health insurance for my first surgery, it was $150,000.
Oh my God. For
But
wait, for your surgery?
yeah, no, I don't pay that amount. That's like I think how much the hospital billed my insurance was $150,000 for one surgery.
Oh my God.
And I think I paid like $3,000. I'm not sure. Yeah, which is actually, I mean, in comparison, that's really small amount. $3,000 for a surgery, like when it could have been 150,000.
Wow. Like, do you know what I complain about in my country? The insurance right now.
Hmm.
So, what is happening in my country, if you're above 18,
Hmm.
and you go to the hospital, you have to spend, like, if I go to the hospital now, then for a checkup or whatever, I'm spending around 380 or 390 and then euros, which is probably like $420
Yeah,
or something.
yeah.
um and I'm like, oh my God, we're like becoming America because now I'm paying for this. And then when I have like any type of don't worry, I love America. And and when I have medicine that is not included in my insurance, I'm like, oh my God, I'm paying these people like 100, I don't know,
No, I mean, you
130.
have your expectations though, so I understand that as well. You think
Yeah.
I live here, it's supposed to be included. What are all these extra things, you know? So I would be
Yeah.
upset too. Absolutely.
Yeah, but
I
if
mean,
I hear your story, like what I do, That's insane. Like I'm clean from cancer for 14 years this year, and whenever
Mhm.
there's something with my leg, I go to the doctor and I'm like,
Mhm.
okay, well, there's something with my leg, I don't know what's going on. So she's like, okay, let's do a scan. So we do a scan, and I mean, right now I'm paying that amount up until I completely paid the 400 euros,
Mhm.
and then
It's like your
after that, then I'm
deductible, right? Like you pay a certain amount and then everything's covered after that. Is that?
absolutely.
Yeah, that's what we have here too, but your deductible is 400. Mine is like what, 2000?
Oh my God.
And and our out of pocket, so we have an out of pocket maximum. So I was able to meet that through the surgery, and that's like $5,000.
Oh my God.
Yeah, so it's like much, much higher. But the good news was I met that very early on in the year. So all my surgeries were in like April. So
Nice.
luckily I met my out of pocket in April, and then everything since April has been 100% covered except for the genetic testing. For some reason they're being difficult. Well, and
Oh.
also, now that it's February, everything renewed in January.
Yeah.
So so now I'm paying for everything again.
Yeah, but it's just I have the same thing, by the way. It's insane. I mean, what I
Yeah.
read as well in America is that again, this is about childhood cancer, but I'm sure this is also for adults. Is like
Mhm.
I'm hearing and seeing stories from people who have cancer or a specific or like terminal cancer almost,
Mhm.
and their chemo is not covered, so they do a GoFundMe. And I'm like, how
Yes.
can
Yes.
your government not support your treatment? And you like GoFundMe for me is like, let's build the biggest treehouse, and let's build the,
Mhm.
I don't know, something like that, like for
Yes.
hobby and for fun and for good
Yeah.
stuff, and not for, oh my God, my doctor or my insurance is not paying for my chemo. I need like $2,000 or something for two
Right.
packs of
Well,
chemo.
and it's a very controversial
Uh,
topic too when people do the GoFundMe. So I was going to say GoFundMe's can there's kind of two schools of thought here on GoFundMe too, because a lot of people, they don't like people asking for GoFundMe money because it's like we're all in the same boat.
mm,
So I feel like some people are too prideful to ask for the money and they just pay for it themselves. And then other people, they're like, oh, I don't care. I need all the help I can get. So there a lot of people do not, they kind of look down on GoFundMe here, because there's almost like a resentment.
oh wow.
Uh,
Because of people
yeah,
using it?
well, like, I'm
Like
trying to
for
think
chemo?
of it.
Yeah.
Yeah, like I think it's just like a lot of people think, uh like, I don't know, like I had to pay for my treatment all on my own. Like why are you asking for everybody to give you money? Like yeah, I don't know. There's like some people think like they're too prideful to take money from the community, and they're just going to go into debt themselves and pay for it on their own. And
Right.
then there's the people that are, I don't know, I guess that's the difference though in America. I think it kind of is a perfect example of the red versus the blue in America, and the more conservative versus the liberal. um I mean, it's like GoFundMe is almost like the, I don't know, the social media equivalent of like welfare in some people's eyes,
Yeah.
So
Right.
it's a controversial topic, but I agree it should, like, I mean, in your eyes it should be used for fun things, not like, oh my God, my this is a life or death situation if we're not able to pay for things.
Yeah, well,
So,
for me, like
mhm.
I'm completely not judging like the people who are doing that. I completely get that because their government is like, sorry, I didn't mean to come across like that. It's
No,
more
no,
like
no, go ahead.
it's so sad that people have to do that and are
Yeah.
in a situation to have to do that, because I'm like, oh my God, your government, even in Europe, like we don't have cross-border healthcare, yet everyone well, most political people are like, oh my God, we're so super, for Europe, and we're, doing export, import, and we're having a blast. I'm like, you don't even have cross-border healthcare. If
Hmm.
something would happen, I know people from Portugal who had, like, not a misdiagnosis, but there was something with them and with the cancer.
Hmm.
And the doctor said, well, we need to do ABC, and then they went to a second opinion in London.
Hmm.
And I mean, I don't know if they. I don't think she got like cross-border healthcare for that because she got treatment there further. I mean, how, like, and then you have, like, I don't think she did the GoFundMe thing, but I'm like, it's
Yeah,
so sad, you
how
know?
did you take care of that? Yeah,
Mm-hmm.
how did you get the best options that you need?
Yeah.
I mean, I was really grateful that I didn't really feel the need to get a second opinion. Because I mean, that is a concern. Is like, oh, if I want to go see this specialist at a different hospital, is he going to be in my network for my insurance coverage? Because that's another thing. You have doctors who are in network, and then you have doctors who are out of network. It's so
Right.
funny. I don't realize how many layers there are until I keep talking about it. But you're right. There are so many rules to the U.S. healthcare system that I didn't even really realize.
Yeah, well, okay, I don't know if this is a weird question, but are you into horror movies?
I like psychological thrillers. I'm not a big fan of the gore.
Oh, okay. Well, me and my
Unless it's a
previous
classic. I like classic horror
Oh,
from back
okay.
in the day.
Yeah, me and my previous boyfriend, we watched he survived cancer twice, and I'm like, "Oh
Wow.
my God, we need to watch Saw."
Oh yeah, I've
So
seen that one. I've seen that.
so I
Yes.
learned a lot from Saw 6, which is like the insurance company, and he's being denied, and that's why I
Totally.
can
I
talk,
remember that one. Yeah.
right?
Have you seen that show Breaking Bad?
Yes.
Yeah, that's another perfect example of, the lengths that people will go to try and get around this huge, huge problem.
Yeah.
I mean, I had my company at work, I had a number of people raise money for me, but I kept telling them, please, please, please don't I don't want you to try and pay for my surgeries and so I don't want you to see it as paying for my treatment. But they were so insistent on still helping me. And so instead they kind of delivered it to me as here's like money and gift certificates for food delivery so you can have meals sent to you while you're going through treatment. And that was a really, really, really helpful, and I appreciated it so, so much. I just didn't want people to get the impression, like, as much as it's expensive, I guess I didn't want people getting the impression that I couldn't take care of myself.
Mm.
I don't know. I was super grateful for everything though, and it definitely helped. And I would have never, I didn't want to turn it down. I just wanted them to think of it as helping me in other ways rather than here, we're paying your bills or.
Yeah.
So I really appreciated the way that they did it, and they said, here is Uber Eats, so you can get delivery, food delivered to you, and it was helpful. It was very sweet.
That's really good. Yeah, I think like if you're dealing with cancer as a patient and you have people around you who say or want to help, at first you're like, no, 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 it's okay, and then later,
Yeah,
because of course, like you don't want to be, it's not just even as seen as not want to be helped or something, but it's also
yeah,
like, well, I don't really want to have the help. But then later it's kind of like, okay, well, it's really appreciated and thank you so much because it actually really helped a lot. And that's really nice. I think as well for the people who do that are also don't know what to do beside being there for you and helping you in that way. And that's actually a really good way to help cancer patients because
exactly.
I got a entire box filled with get well soon cards, and cancer is not get well soon.
Yeah, I know. I know. Those are the worst.
I'm
I
like,
totally can relate with that one. Like, what am I gonna do with all of these cards?
right, yeah, and I mean it's the gesture is nice, but I mean,
Yeah. No, and
yeah,
I mean, that was ultimately why I welcomed their gifts to me because somebody phrased it to me this way. They said, these people want to help you and they don't know how. And they figured the best way they can do that is by giving you like $10 to get a meal delivered or something. And I'm like, okay, when you phrase it that way, totally. But I was very resistant to accepting help in the beginning. And a lot of it too had to do with I didn't necessarily want all of the attention either.
Yeah.
I was very like, oh God, I don't want all these people coming to me with their pity and sympathy. And I think that's another reason why I took such a positive attitude, because I just didn't want the pity party and the attention and the all the, oh, are you okay? And oh my God, I'm sure you know this one. How are you feeling today? Every day.
Yeah, definitely. Oh my God. Yeah.
I mean, I'm so resistant to it at the beginning. And I think that's why it took me a while to actually be, I mean, it took me a few months to go public on social media about my diagnosis. It took me a long time because I just didn't want it. I didn't want people thinking like, oh, she just wants the attention and she wants the sympathy, because that was the last thing I wanted.
Yeah, me too. Me too. Like
Yeah.
that
Mhm.
was for me as well. Like before I started podcast, I'm like, okay, I wanna help people. I wanna share my story, but not in a, Hollywood movie kind of, oh my God, we're crying our eyes out now, kind of stuff. So,
Mhm.
so,
Totally.
so I'm like, how can I help people, And then, uh, my best friend is like, okay, well, you should do a podcast. And I'm like, great, that's actually really helpful, because then, like, I can talk to you and share, you sharing your story with me and with other people, and not and be like, oh, see, for other cancer survivors or patients, be like, oh yeah, yeah, we get it and we understand it, and we don't want that pity. Like, I like, even now sometimes I see teachers in the city and they're still like, oh yeah, everything was so bad, right, with cancer. I'm like, oh my God, shut up.
Wow. Yeah, I know, and that's like that's what you're so used to hearing too. And it's like, oh, like I don't know, whenever you say cancer, or, you know the look on people's faces, like that is the last thing that we want, is that kind of a response. So
Yeah,
it's like this is helpful because it helps people see that there are so many different angles to how you can deal with this.
yeah, definitely, definitely. And it's actually
Definitely a
funny
lot of different
sorry, what you
approaches.
saying?
I said a lot of different approaches for sure.
Yeah, definitely. And I just laugh when you say that, because at the beginning I didn't know what to say to people, because I walk with a at the time I walk with a crutch, now I walk with a cane. And I
Hmm.
literally just went to a store to like buy lipstick or something, and I have like I don't know how old, like 70, no, not 70, like 60 year old man with his wife, like, what happened to you? And I'm like, I'm like the happiest person. So I just looked at him and I said, well, I had bone cancer when I was 11.
Hmm.
And I got a new hip at age 11. And he's like, he's like,
Yeah.
what did I just
I know.
ask?
Why did I ask this question? I
Yeah,
know. I know.
right?
I'll never forget that when after my surgeries, before I started chemo, I cut my hair really short to a bob, and I was at my friend's baby shower, and it was not a traditional baby shower. There were, tons of people there, men, women, all types of people. And I was talking to this older gentleman and his wife, and they complimented my haircut. And I said, "Oh, thank you. I'm not used to having short hair. I really appreciate that. I just cut it the other day." And of course, what inspired you to cut your hair was the next question. And I, being so new to this question, and not, knowing what to say, oh, do I be honest or do I make up a lie? I just said the truth because I'm so used to saying the truth. And I said, oh, well, I said, I wish I had a fun answer for you, but I'll be starting chemotherapy in a couple of weeks, and I'll be losing my hair. And he felt awful, 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 awful for asking the question. And you could just tell he was just like, oh my God, what did I just do? Blah, blah, blah. And it was so hard for me. I was like, oh my gosh, I shouldn't have said anything. I should have just told him, oh, I just felt like a haircut, and I had the same thing happen a few times when, gosh, I only took off my wigs a couple of weeks. Well, actually, this past Monday was the first day I went to work without a wig on. And so I would get all these comments every time I wore a wig. Oh, I love your hair color. And it's so funny because a lot of people, oh, how long does it take you to style your hair? And like people really like asking lots of questions. And so even when you tell them, oh, thank you, and they won't let it go. They won't just accept the thank you. It's always like, so where'd you go to get it colored? And then I'm like, okay, it's a wig. And then you have to tell them the real answer. And another instance was on Monday when people saw my real hair, and a lot of people at work, they knew what I had been going through, but they didn't realize that I had lost my hair. And I guess they didn't realize I've been wearing wigs to work for the past few months. And one of my older coworkers, he goes, oh, Alisa, you cut your hair. And I said, actually, I've been growing it. And he's like, oh, you've been hiding this whole time. And he had a very sweet reaction, and I appreciated it. But I mean, it's just funny how many reactions you'll get from people, and how it's like every single time you're like, am I going to be honest? Am I going to dodge this question? Am I just going to dismiss it and say thank you? It's like every single time it's like, I don't know what to do here.
Right, I know. I completely get it. Like sometimes I remember a few times I just sit at the bus stop and I just have someone sit next to me and it's like, "Oh, nice cane." And what happened? And sometimes and then, sometimes I play a game and they're like, "Did you foul?" I'm like, "Yep."
Yeah.
"Oh, and what happened? Is it in your knee?" I'm like, "Yep." "Oh, is it in your muscle?" "Yep." Like absolutely. Were they unicorns? Yep. Yep. Were they
Yeah, yeah.
rainbows? Yep. Yep. You
I
know,
love it. I
and
know. You're like, which answer am I gonna go with today?
and like the other day, like no, like 2 weeks ago, I had to do an X-ray picture for my leg, and there was a guy, and a very nice guy, but he was very, very serious about his work, and and I have like a 30 centimeter scar on my right leg, and
Mhm.
um, and he's like, "Oh, what happened? Did you fall?" And I'm like, "Oh God, I have to tell him I have cancer." I'm like,
I know.
like, like I
I
feel
know. It's
bad for the
literally the
guy.
worst.
What'd you say?
I said it's literally the worst thing you have to do.
Yeah, yeah, like oh my God. And then they also took like 3 centimeter bone from my left leg, so I have a 15 centimeter scar. So I said no, and on the other bone leg they took bone out, and he's like,
Mhm.
oh, did they put the bone in your other leg? And I'm thinking, I don't think that's biologically possible, but and I said,
Yeah.
no, I got a prosthetic hip. And he's like, okay, lay on the couch.
Interesting question. I mean, I would think that if the bone needed to be taken out of me, why would you want to put it back in?
Right? And that's not possible. Like, you need
Yeah,
to
even if it was
stretch.
possible, why would you want this thing that needs to be removed put back in? That's like removing my one ovary and putting it on the other side.
Right? Oh my God.
That's so
Oh,
silly. I know,
yeah.
I know the amount that I feel like we've been forced to learn medically too. It's like you have to remind yourself, like, okay, not everybody knows, like, like what a port is, for instance. Like I have a port implant or the porta-cath thing, and I remember I didn't know what that was a year ago. So it's hard like casually mentioning it to people because I mean, a year ago if somebody would have showed me their port, or I would have been like, "What's that? What's that bump on your chest?" And it ends up being this huge conversation. And so it's just it's almost like you have to remind yourself, okay, not everybody is super involved in the medical world. They don't know what these terms are. They don't know what like makes sense or not. And then I have to do the same too when it comes to like health insurance. I
Yeah.
have to remind myself talking about health insurance. Oh, not everybody has gone through these experiences. And I have friends that don't even know what a deductible is and stuff because they've never had to worry about it. They just pay their annual payment and that's it.
Yeah. Yeah.
So it's like we're fortunate and unfortunate in so many ways.
Yeah, definitely. It's crazy. It's oh my God. But it's so funny though. But sometimes it's just annoying. I'm like just like one
Yeah.
time I was in the city and I don't know, my parents know this guy and he's like, "Oh, well, what happened to you?" And I'm like, "Okay, I'm not gonna mess around anymore." I just say, "Okay, well, I had cancer."
Yeah.
Well, no, sometimes I say that, or I say like, well, I was sick when I was younger, and then it's the question whether or not they're gonna keep asking me what happened. So,
Yeah.
so he's like, oh yeah, and then I told him like, well, I had cancer, and he's like, oh yeah, 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 my wife, who is also like, I don't know, 70 or something. Yeah, my wife also walks with a cane. Very hard on her, very hard, very difficult for her to move out of the house. I'm like, shut up. I mean, you're a nice
Ah,
guy, but shut up. I don't care
yes.
if you're
Yeah.
like,
Like
your wife didn't have to worry about cancer stuff for like the last 60 years, probably, so please shut up. I'm
I
sure you're
know.
nice.
I
Like,
know.
I don't care, but stop asking me, stop telling me. I just don't
It's
care.
amazing what people like feel compelled to do sometimes. Like one time I was at lunch with my mom and I was wearing a turban and I was you could tell that I was bald and I had no facial hair, no eyelashes, and it was very pale. And I'm at lunch with my mom, just casual on a weekday. It was a fairly empty restaurant. And this older man just decides to come and he literally pulled up a chair and sat at the table with us at lunch and decided to talk with us about his wife who had gone through cancer. And I mean, he was very long winded and is so much older that I was like trying to be so respectful and let him tell his story. And I thought it was going to be a total sad story the way he was telling it. It was sad, sad, sad. And at the very end, once he's finishing up with us, he's like, well, and my wife has been 10 years cancer free, and I just want you to know that things are going to get better. And I appreciated it at the end. I'm like, okay. But the entire time, I'm like, really? You're going to sit here with me and my mom? We're trying to enjoy our lunch, and you're just going to sit here and take over our lunch and talk about your wife?
That's
And I mean,
crazy.
in the end, I'm like, okay, it was a nice story, and I feel good about what you walked me through the incident as if I was living it with you. But it was very play by play.
That's
But
crazy.
yeah, and I'm like, okay, I'm like, thank God you didn't end it with and she died or something. But
Right.
it's just funny how it's like people they want to get their story out. They see your issue as an opportunity to vent or something.
Definitely. And that's so annoying sometimes.
Yeah, yeah, you're
I
like,
mean,
I'm not in the mood.
yeah, but I mean from only from random people on the street, right? Like I mean
Oh
if
yeah.
I'm at an event or knowing people or don't know people or I know the people from like a convention or whatever or meeting people or networking, of course, I love to hear your story and
Yeah,
or on Instagram or something,
right.
absolutely. But if I'm, gonna shop for new lipstick color, I don't want to hear about your
Yeah.
um 70-year-old wife who is not dealing with cancer or has dealt with cancer but is fine. I just,
Yeah, yeah. You're like, I'm just trying to live my life. I'm just riding the bus. I'm just getting dinner. I'm just going shopping. Like these are the moments I don't want all the attention on me, you
yeah,
know?
definitely.
Yeah.
Oh my
I know.
God.
I'm like, it's so nice to talk with someone, even like you being 11, or what, 14 years out is what you said.
Yeah.
Because you were 11 when you were diagnosed? Is that
Yeah.
what it
Yeah.
Okay. Yeah, so I'm like, even you, 11 or 14 years later, I keep saying 11,
Don't
14
worry.
years later, you, it's like you still have to deal with this because you're still dealing with the effects of what happened to you. So I mean, I can imagine all the things you have to deal with, and being 25 and having all of these things in common with people in their 60s and 70s. Like I totally I can relate to that too. I
Yeah.
mean,
Well, I
I'm
think.
sure
Sorry.
I'm sure you've gone to support groups where you're like significantly the youngest person too.
Yeah, I went to one and I'm like, wow, I'm gonna meet people my age.
No.
And they were like 40. And I'm like, what? What?
Yeah.
You know,
I know
um,
my first support group, all of the people, the youngest person was 65.
no.
It was hard. It was very, very hard. I That's when I realized, wow, this is really unfair. I got diagnosed with a cancer that most people get in their 60s. It's so sad. But
Right?
I mean, I mean, no one deserves a cancer at 11. It's
Well,
awful.
well, now I have, thank you, by the way. I have friends who are also cancer survivors from age 11 or are still dealing with cancer.
Hmm.
And that's because I joined a group organization, Youth Cancer Europe, and that's also for mainly for people who are like young adults who are changing
Hmm.
the European stuff. I don't know what the name is.
Yeah.
So they go like to Belgium, to the parliament, and they're like, work on the cross-border healthcare stuff, and they do absolute amazing work. And that's where I met like most of my incredible friends and people are very dear to me. But before I was like, I'm never gonna go to a group or something because I meet people like 60 and they're like, what's going on? Like,
Yeah, it's interesting having people that are going through the same thing as you who feel like, oh my God, it's so much worse for you though because you're so much younger.
right.
Like because they all feel like, okay, I'm old. This happens to old people. It doesn't happen to young people. So it's hard when you go to connect with people and it ends up making you feel even more isolated.
Yeah, definitely. That's absolutely right about that. Oh my God.
Yeah.
Yeah,
Yeah.
because what I see as well on Instagram, and I'm sure you experienced this maybe, is that if you're dealing with cancer above the age of 18, you're also, of course, curing with adults who are like 60 or 70 years old,
Hmm.
right? So like when I had cancer, I was chemo curing with toddlers and children and teenagers. But of course, you are dealing with like I see like so many memes from the
Oh, the
cancer
cancer
patients.
patient.
Yeah, so
Yeah.
hilarious. Like
Yeah, yeah, I know about being the youngest person in the waiting room and stuff.
yeah, but I'm like, oh my god, I never even thought about that.
Yeah, well, I think the sad part is just because a lot of the people you see are like, you wonder, like, are they going to survive this? And I think that's like, I always tell my friends and everybody I talk to that like whether or not I was going to survive was never a question in my mind of like, oh my God, this could kill me. I never like as much as I knew it was a serious thing, I I cannot imagine ever dying from this. I mean, if
Mhm.
this kills me, I will be very, very shocked. But I think that's also because I'm not in my 70s. Maybe it would be a different perspective. And I think that's the hardest part about being the youngest person in the room is you look around and you wonder like are all of them are they going to make it with me,
Yeah.
and it's really hard watching these people that are really struggling and really sick, and it's the chemo's hard on them because they're not healthy, they're not young. So I as much as you feel like, oh my God, I'm alone and the only people I'm uh, friends with here are all the nurses and receptionists because they're all about my age. It's like that's weird, but at least you have those people to talk to. They're on the other end of it, but they still see the same thing you're seeing, and they're still um, emotionally intelligent and stuff too. And sometimes I'd rather talk to the nurses rather than the patients, anyways, because my goodness, there are some toxic people. Like this one woman tried sitting next to me on my last infusion day, And I was the only person in the infusion room. There were 20 open seats. And of course, she wants to come sit next to me. And she was just the most negative person. She was just complaining. She was mad at the nurses because they said her hair would fall out after 3 rounds. And she's like, well, this is my fourth round and I still have my hair. And she was mad at them for telling her the wrong information. I'm like, you have your hair. It's not like it fell out early. It's still there.
Oh my God.
I know, she was just awful. So I like made up an excuse and I told the nurse, I said, hey, is it okay if I go sit by the window since it's my last infusion day? I think I'd like some sunlight. And I made up a lie. And I
Yeah.
moved seats because I'm like, my last day of chemo is the best. This is one of the happiest days. I am not letting this woman ruin it.
Yeah, well, you needed some sunshine from the dark cloud who was trying to
Exactly. I'm like, get me away from this cloud that's floating around the room and yelling at everybody.
Oh my God. Yeah, like for me, um what I noticed is that like some people are like so negative, but as in like last week I had physical therapy and there was a woman who was there for fitness and there were a lot of coats and stuff and she was complaining about the closet like because the coats were longer than where you can put your shoes and all this and I'm like oh my god please shut up and then right and I'm like oh my god you really do not have any life problems at all. Right.
I know, you really do like lose your patience for people complaining. You're like, God, life could be so much worse. Shut up.
Right. And then she's like, "Well, where is everybody?" So I'm like, "Well, they're probably at the fitness." And then she's like, "Oh no, no, I came here earlier, so I had to avoid that." I'm like, "Shut up. Please. Be happy you have the possibility to physically
Yeah,
visit
you
this
should be
place."
here for other reasons. So
Right?
like,
Oh
yeah.
my God. And
I
like, oh,
know, I know. And it's like it's so funny because I mean, I'm sure you felt this way too. Like you feel like those are the people like no one deserves it, but you feel like those are the people that maybe could learn a thing or two from this type of diagnosis. And
definitely.
like I felt like I didn't need to learn a lesson. I was always a very kind, happy, positive, pretty loving person. Like I didn't need to have to be humbled by tragedy, you know?
Yeah, I
Like,
completely agree because I see or not see but like sometimes hear people or who are like, "Oh, I needed this as a challenge." And I'm like, "This is not a challenge. This is pure survival."
yes. Yeah, like there's this one girl and I think she's beautiful and she's a survivor, but she straight up said, "I didn't like the person I was before cancer." And she actually was like, "Thank you, cancer, for changing me and turning me into this person that can appreciate life and be grateful and blah blah blah." And I'm like, "Okay, good for you. I'm so glad you found the positive, but I liked who I was before. I had no problems with the person I was before cancer. And yeah, it's changed me. And I would say even for the better. But did I need to be changed for the better? I mean, I was a pretty good person before all of this. So
Yeah.
it's definitely interesting seeing the people who say, I was an asshole and now I'm not, you
Yeah.
know?
Yeah. It's interesting to see. Like sometimes I get it from people, but like not like people said it to me, but like stories I read, I'm like, oh, okay, well, it's good it improved you. I mean, I feel like it improved me as in like helping others, appreciation, and all this stuff. But I
Right.
mean, like,
But
oh
yeah,
my
you were
god,
11. Like what kind of you couldn't have been an asshole at 11, you know?
yeah, and also for like everyone around me, like there's no challenge there's no it's not like a challenge is to see how many times you can run up and down stairs or something like cancer is not a challenge
Yeah,
it's
like why would I want that? Like especially something that's like life or death. Like that's a
Yeah.
real like don't that life is not a game.
Absolutely. And like I cured with kids who didn't make it, like toddlers, children who are like 11 or 7 who didn't make it. And I'm like, I'm not going to sit here and say it's a challenge or it's something I had to go through to understand my life. No, it's awful. So, where can people reach out to you and get in contact with you?
So you could message me through my Instagram account. My handle is Zelinator, Zellinator, and I'm very active on there. I usually respond within a day.
Oh, awesome. I will also put your information, like, or your social media, in the description down below, so that'll
Perfect.
be good. Ah, so
Perfect.
yeah. So thank you so much for joining the podcast.
Of course, it was my pleasure.
Yeah, I really enjoyed talking to you and learning so much from you as well.
Yeah, I know. I learned a lot from you, and I really hope we'll be in touch.
Yeah, definitely. That's gonna be really nice. So
Awesome.
thank you guys so much for listening, and I'll see you in the next episode. Bye bye.